everyone, I'm Dr. Shikha Garg. Today we have a guest with us, Dr. Saman Garg. He is MBBS MS Ophthalmology. Along with that, he has done fellowship in glaucoma and he is expert in LASIK and squint surgery as well. So we were discussing about headache. So we discussed about headache looking from the neurological or neurosurgical point of view. What could be the reasons, what could be the complications, how to go about it. So now we'll discuss about headache from the point of view of an eye surgeon. So let's welcome Dr. Saman Garg. Thank you so much.
Thank you.
So tell us what are the common causes of headache from the point of view of ophthalmologist or an eye surgeon.
Well, if we talk about headache from eyes point of view, or let's say ophthalmology point of view, so it's better to study the causes as per age of the person or patient. So like in children, if we say, so in children the most common cause of headache is refractive error, or you can say spectacles or glasses. So if somebody's eyesight is weak, if any child's eyesight is weak, so definitely it should be checked, because if the child needs glasses, then it is one of the most common reason for a child to have headache from ophthalmological or eye point of view.
जो refractive errors हैं, they are more common in children and adults as well. Definitely very common thing, first of all. Second thing, what could be the other reasons?
So if somebody needs glasses, then glasses can definitely result in eye strain, or in common terms, let's say headache. So this can happen at any age. So in children, the most common cause of headache from eye point of view, as we have discussed, obviously is the need for requirement for glasses. Even in adults, if somebody needs glasses and he or she is not using them regularly, so this can result in headache. And for near vision also, so especially when your age is 40 and 40 plus, so if you are not wearing your reading glasses, near vision glasses, then you will experience headache while doing near work or while reading or watching your mobile.
So refractive errors or eyesight कम होना और number लगना spectacles, that is one reason. Is it possible कि dry eye से भी headache हो?
Definitely. Dry eye, which is quite common these days, simply because of excessive use of gadgets like laptop, mobiles and computer. So plus even diabetes and vitamin D deficiency can make your eyes dry. So dry eye, let's say we can say that in children who are using excessive mobiles or laptops, or in adults as well. And dry eye will constantly be giving you heaviness or eye strain or so-called headache, which will be very much when you are watching your mobile or TV. So if somebody is having dry eye, so he or she will definitely be complaining of severe eye pain and headache while watching TV and mobile. So dry eye definitely can result in a constant and a very annoying and irritating type of strain or headache.
So basically screen fatigue is a real thing, right? So let me ask you something. We cannot stay away from screens these days, right? That is not possible, not even for children, because they are getting online classes and everything. For adults, obvious reasons. So what is a ideal or a good screen time which can be allowed to small children starting from the age of like 0 to 10 and above, and for adults? What could be simply we can put about that certain hours are okay?
See, as such, it obviously depends on person to person, but you can still say that safely regular 20 to 30 minutes of screen, it generally would be considered safe. So you definitely need to take a break after every 20 to 30 minutes of your screen time. 2 or 3 more important things you can take care of. One is that please avoid watching your mobile or TV or laptop while in lying down position. So you should be sitting proper straight, and your screen should also be at a certain height so that you don't face any neck problem or cervical problem while watching your mobile or screen. And another thing you can take care of is that please do not watch your mobile or screen in dim light. So if you are watching your mobile or screen in dim light, then again it's going to give you more pain and more fatigue.
latest studies, 0 to 2 years, there should be no screen time. From 2 to 5 years, like 30 minutes, as you said, is maximum screen time. Above 5 to 10, because of certain schools having online classes, so it will, of course, depend on that. And adults, obviously, maximum, you're saying 2 to 3 hours is the maximum cutoff with multiple breaks in between, so that you don't have eye strain, eye fatigue, screen fatigue, or you do not have a dry eye. So apart from refractive errors or dry eye, is there any other cause which is related to eye and giving you a headache?
Yeah, another one is then you can say it's particular eye disease, or what we call it as glaucoma.
Okay.
So if the pressure inside our eyes, if the normal intraocular pressure, if it rises, like it's having a normal value of 10 to 21. So if somebody is having a high intraocular pressure, that is the pressure inside the eyes, which can be measured with specific instruments. So if the pressure is more than the normal, then obviously it is going to result in headache, eye fatigue and redness of the eyes. So in that case we need to check the eye pressure.
So
as
in
well.
glaucoma, or as we commonly call it as kala motia, what could be the difference of the common headache? So what could be a particular kind of headache when we can suspect that this is glaucoma and not a refractive error? Is there a gap of type of headache in that?
Well, generally out of all the various causes of headache we have discussed, like refractive error or the need for glasses or dry eye, so glaucoma as such is less common than these 2 or 3 causes. So if you are not able to get relief in your headache, even while taking adequate precautions, like you are not using any mobile or TV for the last 2-3 days, or you are also wearing your glasses, and still if you are having headache, then might be that your intraocular pressure or eye pressure is rising. So in that case you need to get it checked from your specialist eye doctor.
Kind of a probable diagnosis which needs to be corrected and confirmed.
But unless
by a-
until we get it checked from our eye specialist, we obviously cannot say that it is high pressure, because high pressure is also associated with so much of fear and stress for the patient.
So there are multiple causes basically.
Only eye doctor can check it, and
Yeah,
then we
diagnosis has to be
find
made
it.
by a proper consultant who is ophthalmologist with the proper degrees. Those doctors are able to make your diagnosis for glaucoma particularly. So apart from that, are there any infections related to eye or any other cause which could be rare but might be causing headache?
No, not
common.
not that much.
Not that much. So if people are having acute kind of headache, like if I had, supposedly I have a headache for 1 day, should I visit ophthalmologist immediately, or it should be a chronic thing? Is there certain amount of time which we can give treatment at home, because over the counter drugs are available, everybody tends to get that drug, be it paracetamol, Combiflam, Saridon, whatever it kind of is possible. We have a tendency to treat it ourselves. So what is the time period when we should be visiting the doctor and not taking it in our
Well,
own
if
hands?
you are having headache, or let's say eye fatigue or headache which is too much to bear, you can say that it is out of proportion
Severe, yeah.
to your normal routine. So if it has to be because of your eyes, so if your headache is because of eyes, then in most of the cases your eye will also become red. So in addition to your headache, your eye will definitely give you some more symptoms, like you will be having blurring of vision, you will be having redness of eyes, you might be having watering from your eyes. So then you should immediately consult your eye doctor. Otherwise this can be managed by a neurologist or general physician as well.
Okay, so for to visit ophthalmologist in acute emergency, it has to be associated with other symptoms. And in
Yeah.
chronic cases, of course, if you have mild headache but on a daily regular basis,
Then we
you
need a
should,
thorough
you
checkup.
should get a thorough checkup,
from
starting from
ophthalmologist, eye doctor
ophthalmologist,
and neurologist, and
followed by neurologist if needed,
all the concerns.
depending upon your symptoms.
Yeah,
So thank you so much, Dr. Saab. Thank you for insight of headache.
my pleasure.
So if you have any questions regarding headache related to ophthalmology point of view or eye surgeon's point of view, or if you have any question related to neurological point of view, which we have posted earlier also, please feel free to ask me all the questions in the comment box. Our numbers are also there in the flyer. You can call us on that, or you can contact us directly. Thank you so much. Thank you.